All I wanted to do was get back home.
We come together because we have two common goals: keep patients at home, make them feel safe, make them feel comfortable, and keep them there. And the other is, how do we ensure that the providers also have satisfaction in the care that they're providing for the patients?
I've recently had some pretty outstanding experience with Southlake at home. I recently discharged a patient who I thought would not be able to be discharged from hospital and may require long-term care or an assisted living facility upon discharge. Previously, when I would send somebody home, I would actually have very little communication with what happened once somebody was discharged. When the care team from Southlake at Home started to recognize that things were going awry at home, they immediately contacted their primary care physician as well as myself. We were able to arrange a conference with the entire care team via telephone and achieve the desired result. And to this day, the patient remains at home and has not had to come back into hospital. So that was definitely a success.
All members of the Southlake at Home healthcare team are used to their fullest potential. The Southlake at Home program is really helping us get to where the system really needs to go.
All the partners work together collaboratively and put the patients and the families at the heart of care when designing their care plan on discharge, with a sole focus on ensuring great outcomes for the patients, the families, and the providers.
I had a fall here, and then I went to Southlake. For the first week I was home, I've had an occupational therapist come, and a nurse comes in every 3 days. Overall, it's been very good. I've been very happy with what they've done for me.
The Southlake at Home program, compared to previous options, there was far more coordination of care, far more care options being offered, and far more timely. We knew that Rita was going to get PSW the day she came home without a wait.
Southlake at Home partnership with CHATS has helped to get the wraparound services for the clients when they are discharged from the hospital to home. And Southlake Hospital staffs know more about the services that they could get from CHATS in the community for the clients to live at home and also live safely.
Once a week, together we have what's called a champion meeting, which is really a working group between all parties. Any of the constructive feedback that we've received from the patients and or the providers, we've taken back to our working group and look at quality improvement to see how we can change processes to make the patients feel confident in their care.
I found that since we've started with Southlake at Home, there's been a benefit in terms of collaboration between primary care and hospital care, as well as interprofessional collaboration both in the hospital as well as at home. I've noticed personally a decrease in readmissions of some patients that I've sent home that would have otherwise been readmitted to the emergency department and into the hospital as well.
It takes a village to help ensure that a patient feels safe and confident that their care needs are going to be met when they return home. We invite you to join us and expand our village.